And tonight, stockholders investing in Co-Diagnostics allege the COVID-19 tests the company uses in Utah are not accurate. But as ABC4 News investigator Jason Wynn shows us, Governor Herbert says he's okay with their accuracy results.
This is the complaint filed in federal court stating Co-Diagnostics, a Utah company that's responsible for the COVID-19 test at Test Utah, is misleading the public and shareholders about how effective their test is. The Utah Department of Health tells me Test Utah is a state contract with Nomi Health, and Nomi Health subcontracts all its needs. One of the subcontractors is Co-Diagnostics, who provides the FDA-authorized COVID-19 test. And Co-Diagnostics tells me their test is 100% accurate.
There's a reason the company has stuck to its guns on 100%. They know that the difference between 100% and 95% is monumental in terms of the viability of the test for public health purposes.
That 95% accuracy result recently came from the Iowa State Hygienic Lab. Lauren Washburn represents select stockholders who say they bought Co-Diagnostics stock because they were sold on the reliability of the test.
Since evidence has come to the market's attention that shows that those representations of 100% accuracy were wrong, the stock price has fallen in half. To put that in perspective, $400 million of shareholder value in Co-Diagnostics has evaporated.
Governor Gary Herbert says he's satisfied with the results.
If they're 95% accurate, that's pretty good compared to all the other tests that are available out there. So maybe not 100%, but 95% is pretty good, and we'll continue to work with anybody that's in that 90% ratio of accuracy, because I think it's hard to find anybody better than that.
Co-Diagnostics' Andrew Benson tells me in a statement, Co-Diagnostics stands behind the quality of our technology platform and the performance of our testing products. We intend to vigorously defend this matter. Nomi Health adds the accuracy of their COVID-19 testing products speak for itself, and Test Utah continues to rely on them for statewide testing needs. The state put out requests for proposals on lab capacity and sample collection. The contract extension with Nomi Health should expire on July 15th. The state says they should know who is going to be collecting samples and testing them by then. In the newsroom, I'm Jason Wynn, ABC4 News.